Hi, I'm Dr. David Coram. Welcome to Mariana's Eye Institute. I'm here to talk to you a little bit today about cataracts. A cataract is when the natural lens inside the eye becomes cloudy. When the lens gets cloudy, the light cannot pass into the eye well. I tell my patients that this is a little bit like the window in a house or a car getting foggy. When that happens, you just can't see out the window very well. That's a little bit like cataracts. When a cataract begins to develop in the natural lens of your eye, it gets difficult to see through it. You don't really need to do anything about cataracts unless it's interfering with your vision. If cataracts are interfering with your vision, then there's something that we can do to help improve your vision. Glasses usually don't work, medications don't work, and eye drops don't necessarily help to improve the vision. But there is a good treatment, and that's what we call cataract surgery. Most of the time when I say surgery, people get scared, especially when we're talking about the eye. I tell my patients that for you, the operation is easy. You come in the morning, you have the surgery, you go home the same day. You use eye drops for several weeks after the surgery, and most of the time the vision is improved after the surgery. Now, anytime we do surgery anywhere on the body, there are some risks. And the major risks of surgery around the eye are the risk of infection or the risk of bleeding. If either of those two happens, it can result in total blindness, even loss of the eye. I don't tell you these things to scare you. It's just my job as your doctor to make sure you understand there are risks involved in case, God forbid, something should happen. At least we talked about it beforehand. Those kind of significant risks that result in blindness are about 1 out of 1,000. So it's a small risk, relatively, but it's still very real. And I tell my patients that even if it's a 1 in a million risk, if it happens to you, it's still important that we have the conversation ahead of time. There are other things that can happen. 97% of the time, the operation goes smoothly and the recovery is smoothly. About 3% of the time, it's what I call a rocky road, meaning you might need eye drops for a little bit longer, the pressure inside the eye might be elevated, you might need another operation, but the end result is still improved vision. So, 1 out of 1,000 chance of a severe risk, and 97% chance of things going totally smoothly. There are some things that I talk about with my patients about the different types of lenses that we can put into the eye. Most patients get what we call a monofocal lens. Monofocal means it's set for one distance. And most people like me to put a lens into their eye that sets the vision for the distance. And then they wear glasses for near. Other patients say, you know what, most of my life is up close, most of my visual needs are up close. Put the lenses in my eye for my vision to be clear up close, and I'll wear glasses for distance. Of course, the calculations that we use are only an estimate. So it's by no means guaranteed that you'll see clearly, perfectly in the distance. I tell my patients, or near, but I tell my patients, expect to wear glasses afterwards. There's another type of lens that we can use that's called a multifocal lens. And it's to correct the distance and near vision together. There's not just multifocal lenses, but a whole category of lenses that I call special lenses that are used to correct distance and near vision together. Not everyone is a good candidate for those lenses, and those lenses are not covered by insurance. They cost about $2,000 per eye, and they usually need to be done in both eyes. That's a complete out-of-pocket expense. Because there's not much demand for that on Saipan, and because most of our patients want the monofocal lens, we don't even carry or offer the multifocal or near vision correcting lenses here. If you think you're interested in that, I can make arrangements to send you off island for that surgery. Our clinic can do that for you. It's just important to keep in mind that you'll have to pay for those lenses yourself, And also it's not covered by medical referral, so the travel costs are there as well. And I think that explains why most people choose the multifocal lens. Most people choose the monofocal lens, the normal regular lens, and it's the most common lens implanted around the world. So we've talked about the benefits of cataract surgery, which is we expect the vision to improve, the alternatives, which is to do nothing, and the risks, which I've talked with you about. We've talked about the different types of lenses that can be used for cataract surgery. There's a lot of different things that are important to know about cataracts and cataract surgery. Oh, there's another type of lens also that we may have a conversation about, and that's to correct astigmatism. Astigmatism is when your eye is shaped a little bit more like a football than a basketball. And there's a special type of lens that can be used for that, and if you're a candidate for that, we can talk about it. It's also an out-of-pocket expense, but we do offer it here, and it's not nearly as much as it is for the multifocal or those other special lenses. So this is just a preliminary conversation. We can talk more, but I felt like this would give you a better idea of what cataracts are all about. We have a very detailed permission form for you to read over carefully so that you understand all the issues and what the process is with the cataract surgery, what some of the other risks may be, and what to expect from it. Again, if you're not having any difficulties with your vision, there's no reason to do the surgery. But if you feel like you're having problems, it is something that we can do. It's the most common surgery that we do and one of the most common operations in the world. So thank you very much for taking the time. If there's any questions you have, please talk to one of us. We're more than happy to help you, and we look forward to serving you. Thank you.